So I'm here with Katie today. You guys will all recognize Katie. Our topic of the day is pigmentation. September is a great time to start talking about pigmentation. The summer is coming to a close and sun exposure is decreasing, and it's a good time to get after the pigmentation. So Katie's main concern is some light areas of pigmentation, especially around her mandible and jawline. You can see it a little bit on this image, but then when we look at what her browns look like, this program can pick up pigmentation and you can see where most of the browns are. So our goal is to chase this. Some of the ways to manage pigment are with laser, and that's what we're going to do today. This is the Cutera 532 wavelength, and we're targeting the browns specifically. Now this also is done in conjunction with a really good skincare regimen. So we'll talk briefly about kind of the topicals that are best for treating pigmentation. Number one for almost everything in skincare is sunscreen. Total Defense and Repair, this one specifically is an SPF 50, so you get your protection, but it also has antioxidants that are helping your skin recover as you're protecting it on a daily basis. So this is one of the probably most well-utilized products in our practice by all of us who work here. So it's definitely a staff favorite. Second thing that helps with pigmentation is getting on a retinol. Retinol increases your cell turnover rate and helps repair those cells. With increased turnover rate, you're able to get rid of the pigment more quickly if you're on a treatment regimen, either with lasers or peels. Lytera 2.0 is specifically for targeting this pigment. Pigment's very stubborn, and although we can see lightening with lasers and peels and topicals, kind of keeping it at bay is also really important. So this is helping to treat the pigment that's there and also to decrease the pigment that's going to happen in the future. This works well as a twice-a-day regimen. The retinol is just once a day at night. This is twice a day, morning and night, and then of course your sunscreen on top during the day. And finally, being on a good cleanser through any of these treatments, keeping your skin well exfoliated so that your products are penetrating well. The AHA cleanser is one of my favorites. And so now to go to the laser. First, we're going to all protect ourselves here. Get your goggles. And you'll see this is a relatively comfortable treatment. Is that just a good amount of tightness and looseness? You want it tighter? And we're going to put a little gel. And this is a treatment that we can use all over her skin. Katie has not a lot of dark pigment, but she has a lot of light pigment. And that's what makes this treatment really nice, is we don't have to spot treat. We can just treat all of the skin. If she had some really dominant dark spots, we can also treat those one by one. Which maybe has one little tiny one right here. And the rest is just kind of diffuse background pigmentation. Okay. And this laser just takes a minute to cool. The reason that we want it to cool is because we're delivering heat to treat and target that pigment, and there's a sapphire crystal in here that helps keep it nice and cool, so it makes the treatment a little bit more comfortable. And you'll see after we treat, you'll see like a little bit of redness. Here we go. It feels a little zingy, right, Katie?
Mm-hmm. Not bad.
couple weeks ago, we treated some of Katie's vascular spots. So there's a different wavelength for reds, but in general, lasers, based on the wavelength, can treat reds, can treat browns. It can also be used for collagen stimulation. How you doing?
Mm-hmm, good. No, it's good. It's a quick little
Just
zap.
it's a quick little zap. The side that's treated versus the side that's untreated, it's a little pink. You know, it's a little bit of redness, but nothing. There's
Little warm.
Yeah, a little warm. Nothing that's going to be open or sore. I'm just going to cool her skin a little bit so it's not so warm. And that redness will really dissipate over the next 30 minutes or so. Does that feel a little better?
Mm-hmm.
You can see the areas that are the most red are the areas where she had the most pigment, which is really kind of down here a little bit. That's how lasers work, is by targeting. So specific wavelengths target specific what we call chromophores. So in this case, our target is the pigment. And so it's meant to get those pigment cells, but not to do anything to the normal skin cells. And you can see after a spot's treated, like this little spot here, it's a little darker than it was just a second ago. And that's typical. They get a little bit darker and then they fade away. It's like a full day, Katie.
I know, it's awesome. Such a good week. Okay, good week.
Taking a little time for maintenance. Two little spots over here. Good. So we'll do next is we're just gonna take off that jelly. You can really see what her skin looks like immediately after treatment. And how does your skin feel now? Just warm, or any areas that feel uncomfortable?
No, just a little warm.
Yeah.
But not bad at all.
See, she's just a little bit rosy. And once we put her sunscreen on, and if she wanted to put a little makeup on, that's fine. She can get back to her usual day immediately. Occasionally people get a little bit of swelling after treatments like this, but it's the kind of swelling that just makes actually your skin feel and look a little bit more youthful, like a little bit more plump. Nothing that's that looks out of the ordinary or bizarre. It's just a little bit of diffuse swelling or edema, and she can go on with the rest of her day.